Question 1. The investigation demonstrates that a recent systematic review published in a peer-reviewed journal suggests a novel pharmacological approach to managing chronic neuropathic pain that shows statistically significant improvements in patient-reported outcomes compared to the current standard of care. The certified pain management nurse is aware of this publication, but continues to prescribe the established treatment regimen based on previous clinical experience and institutional protocols. Option A. Continue with the established treatment regimen, as institutional protocols and prior clinical experience are sufficient for managing chronic neuropathic pain. Option B. Dismiss the findings of the systematic review due to its recent publication and the potential for preliminary results to be revised. Option C. Immediately discontinue the current treatment and implement the novel pharmacological approach as described in the systematic review. Option D. Critically appraise the systematic review and consult updated pain management guidelines to determine if the new pharmacological approach should be integrated into practice. Correct answer is D. Critically appraise the systematic review and consult updated pain management guidelines to determine if the new pharmacological approach should be integrated into practice. Explanation. The investigation demonstrates a common challenge in pain management nursing: the integration of new research findings into established clinical practice. Nurses are ethically and professionally obligated to provide care that is informed by the best available evidence. This scenario requires a nurse to critically evaluate the evidence and determine the most appropriate course of action, balancing patient safety, efficacy, and adherence to professional standards. The correct approach represents best professional practice because it prioritizes the systematic review and integration of evidence into patient care. This aligns with the core principles of evidence-based practice (EB), which is a cornerstone of modern healthcare. By consulting updated guidelines and critically appraising the new research, the nurse ensures that patient care is based on current, validated knowledge, thereby optimizing outcomes and minimizing risks. This proactive engagement with evolving evidence is a hallmark of a competent and ethical pain management nurse. An incorrect approach that involves continuing with the previous protocol without considering the new research fails to uphold the principles of EBP. This can lead to suboptimal patient care if the new evidence suggests a more effective or safer treatment. Ethically, it represents a deviation from the duty to provide competent care informed by current knowledge. From a regulatory perspective, many professional nursing bodies and healthcare organizations mandate adherence to EBP, and failing to do so could be considered a breach of professional standards. Another incorrect approach, which is to immediately implement the new research findings without critical appraisal or consideration of existing guidelines, also presents significant professional and ethical risks. While seemingly proactive, it bypasses the crucial step of evaluating the quality and applicability of the new evidence. This could lead to the adoption of interventions that are not yet robustly validated, potentially compromising patient safety or introducing ineffective treatments. It also risks disregarding established, evidence-based protocols that may still be relevant and effective. A further incorrect approach, which is to dismiss the new research due to its novelty or perceived complexity, demonstrates a resistance to professional growth and a failure to engage with the evolving body of knowledge in pain management. This can lead to stagnation in practice and a failure to adopt potentially superior treatment modalities. Ethically, it can be seen as a dereliction of the duty to stay current and provide the best possible care. The professional decision-making process for similar situations should involve a structured approach to EBP. This includes identifying a clinical question, searching for the best available evidence, critically appraising the evidence for its validity and applicability, integrating the evidence with clinical expertise and patient values, and evaluating the outcomes. Nurses should actively participate in continuing education, engage with professional literature, and collaborate with colleagues to ensure their practice remains informed by the latest evidence. Question 2. Upon reviewing the initial assessment of a patient presenting with chronic back pain, the certified pain management nurse notes that the patient is of a cultural background known for stoicism regarding pain expression. The nurse needs to determine the most appropriate approach to accurately assess the patient's pain experience and develop an effective management plan. Which of the following approaches best reflects culturally sensitive pain assessment practices? Option A. Interpret the patient's quiet demeanor and lack of overt complaints as an indication of minimal pain, and proceed with a standard pain management protocol. Option B. Inquire about the patient's cultural beliefs and practices related to pain, its expression, and its management, using open-ended questions to encourage them to describe their experience in their own words and observe nonverbal cues. Option C. Rely on the patient's family members to provide an accurate report of the patient's pain levels, as they are likely more familiar with the patient's cultural norms. Option D. Directly ask the patient to rate their pain on a 0-10 numerical rating scale and document the score, assuming this standardized measure will capture the full extent of their discomfort. Correct answer is D. Directly ask the patient to rate their pain on a 0-10 numerical rating scale and document the score, assuming this standardized measure will capture the full extent of their discomfort. Explanation. Scenario analysis. This scenario is professionally challenging because effective pain assessment is foundational to appropriate pain management. Failure to consider cultural factors can lead to misinterpretation of a patient's pain experience, resulting in undertreatment or inappropriate interventions. This requires the certified pain management nurse to move beyond a purely biomedical model and engage in culturally sensitive communication and assessment. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a patient-centered, culturally informed assessment. This aligns with ethical principles of beneficence and respect for patient autonomy, as well as regulatory guidelines that mandate individualized patient care. By actively seeking to understand the patient's cultural context, the nurse can gather more accurate information about their pain, its meaning, and their preferences for management, leading to more effective and respectful care. This approach upholds the professional standard of care by acknowledging that pain is a subjective experience influenced by a multitude of factors, including culture. Incorrect approaches analysis. One incorrect approach involves assuming that pain expression is universal and relying solely on standardized pain scales without further inquiry. This fails to acknowledge the significant impact of cultural norms on how pain is perceived, communicated, and managed. Ethically, this can lead to a violation of patient dignity and autonomy if their unique experience is not validated. Regulationally, it may contravene requirements for individualized care plans that account for patient-specific factors. Another incorrect approach is to dismiss or minimize a patient's reported pain based on perceived cultural stoicism or a belief that the patient is exaggerating. This is a form of bias that can lead to significant undertreatment of pain, violating the ethical duty to relieve suffering. It also demonstrates a lack of cultural competence, which is increasingly recognized as a critical component of quality healthcare delivery and may be implicitly or explicitly required by professional standards. A third incorrect approach is to make broad generalizations about a patient's pain experience based on their ethnicity or cultural background, without individual assessment. This stereotyping can lead to inaccurate assumptions and prevent the nurse from understanding the patient's specific needs and preferences. It undermines the principle of individualized care and can result in culturally insensitive or ineffective treatment, potentially leading to patient dissatisfaction and poorer outcomes. Professional reasoning. Professionals should employ a decision-making framework that begins with recognizing the subjective nature of pain and the influence of cultural factors. This involves active listening, open-ended questioning, and a willingness to learn about the patient's cultural background and its potential impact on their pain experience. The nurse should utilize validated assessment tools but remain flexible, adapting their approach to incorporate the patient's verbal and nonverbal cues, as well as their cultural understanding of pain. When in doubt, consulting with cultural liaisons or experienced colleagues can provide valuable insights. The ultimate goal is to build a trusting therapeutic relationship that facilitates accurate assessment and effective, culturally congruent pain management. Question 3. Operational review demonstrates that a patient receiving a scheduled dose of a potent opioid analgesic for severe pain is exhibiting increasing somnolence and a decrease in respiratory rate from 16 to 10 breaths per minute. The nurse has administered the medication as prescribed. Which of the following actions best reflects adherence to regulatory requirements and best professional practice in managing this situation? Option A. Reassess the patient's pain level and administer an additional dose of the opioid analgesic to address the underlying pain, assuming the somnolence is a result of inadequate pain control. Option B. Continue to monitor the patient's pain score closely and document the somnolence and decreased respiratory rate without further immediate intervention. Option C. Immediately administer a naloxone dose as per protocol and notify the prescribing provider of the patient's respiratory status and the naloxone administration. Option D. Administer a PRN dose of a stimulant medication to counteract the somnolence and observe for improvement in respiratory rate. The correct answer is C. Immediately administer a naloxone dose as per protocol and notify the prescribing provider of the patient's respiratory status and the naloxone administration. Explanation. Scenario analysis. This scenario presents a common challenge in pain management, balancing the therapeutic benefits of opioid analgesics with their significant and potentially life-threatening side effects. The professional challenge lies in the nurse's responsibility to not only administer medication as prescribed, but also to proactively monitor for adverse reactions, educate the patient and family, and intervene appropriately to mitigate harm. This requires a deep understanding of pharmacology, patient assessment skills, and adherence to established protocols and regulatory guidelines for controlled substance management and patient safety. The complexity arises from the individual variability in patient response, the potential for drug interactions, and the need for timely and accurate reporting of adverse events. Correct approach analysis. The correct approach emphasizes comprehensive patient assessment, vigilant monitoring for opioid-induced side effects, and prompt, evidence-based intervention. This aligns directly with the core tenets of safe nursing practice and regulatory requirements for patient care, particularly concerning high-risk medications like opioids. Regulatory frameworks, such as those governing advanced practice nursing and pain management, mandate that nurses assess patients for side effects, implement appropriate interventions, e.g., dose adjustment, administration of reversal agents if indicated and within scope, and document these actions thoroughly. Furthermore, ethical principles of beneficence and non-maleficence compel nurses to act in the patient's best interest and avoid harm. Proactive patient and family education regarding potential side effects and warning signs is also a critical component of risk mitigation and patient empowerment, often a requirement in pain management protocols. Incorrect approaches analysis. Administering the opioid without a baseline assessment of respiratory status, and then only reacting to a significant drop in respiratory rate, represents a failure to adhere to proactive monitoring standards. This reactive approach increases the risk of severe respiratory depression, and its sequelae, violating the principle of non-maleficence and potentially contravening facility policies and nursing practice acts that require ongoing assessment. Focusing solely on pain score reduction, without considering the patient's overall physiological status and potential adverse effects, overlooks the holistic nature of patient care. While pain relief is a primary goal, it must be achieved safely. Ignoring signs of opioid toxicity, such as somnolence or pinpoint pupils, in favor of a subjective pain score, is a significant breach of professional responsibility and regulatory oversight for medication administration. Discharging the patient with a prescription for a potent opioid without providing explicit instructions on potential side effects, warning signs of overdose, and emergency contact information is a critical failure in patient education and safety. This practice not only increases the risk of adverse events occurring post-discharge, but also fails to meet the standards of care for patient education and discharge planning, which are often stipulated by regulatory bodies to ensure continuity of care and patient safety. Professional reasoning. Professionals should approach this situation by first recognizing the inherent risks associated with opioid analgesics. A systematic approach involving a thorough baseline assessment, including respiratory rate, level of consciousness, and pupillary response, is paramount before administration. Continuous monitoring for signs and symptoms of opioid-induced adverse effects is essential throughout the treatment period. This includes regular reassessment of vital signs, pain levels, and the patient's overall clinical status. Patient and family education should be ongoing, covering expected side effects, signs of toxicity, and when to seek immediate medical attention. Documentation should be meticulous, reflecting all assessments, interventions, and patient responses. In cases of suspected adverse events, immediate notification of the prescribing provider and adherence to facility protocols for managing such events are critical. This decision-making process is guided by a commitment to patient safety, adherence to regulatory mandates, and the ethical principles of nursing practice. Question 4. Examination of the data shows a patient reporting severe, persistent burning and tingling pain in their lower extremities, exacerbated by light touch, with no clear objective findings of tissue damage on initial physical examination. The patient also expresses significant anxiety and sleep disturbance related to the pain. Which of the following approaches best reflects a comprehensive evaluation of this patient's pain experience? Option A. Conclude that the pain is primarily psychogenic due to the lack of objective physical findings in the patient's anxiety, and refer for psychological counseling only. Option B. Conduct a detailed differential diagnosis to differentiate between nociceptive, neuropathic, and psychogenic pain components, considering the patient's subjective report, physical findings, and psychological state. Option C. Immediately initiate a regimen of opioid analgesics to address the patient's reported severe pain, assuming it is primarily nociceptive in origin. Option D. Focus solely on physical therapies and non-pharmacological interventions for nociceptive pain, as objective physical findings are absent. The correct answer is B. Conduct a detailed differential diagnosis to differentiate between nociceptive, neuropathic, and psychogenic pain components, considering the patient's subjective report, physical findings, and psychological state. Explanation. Scenario analysis. This scenario presents a common challenge in pain management, where a patient's reported pain experience may not align with objective findings or typical presentations of nociceptive or neuropathic pain. Differentiating between these pain types and considering the potential influence of psychogenic factors requires a nuanced assessment that goes beyond purely physical examination. The professional challenge lies in accurately identifying the primary drivers of the patient's suffering to implement the most effective and ethical treatment plan, avoiding both undertreatment and inappropriate interventions. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates subjective patient reports with objective findings and considers the potential interplay of psychological factors. This aligns with best practices in pain management, emphasizing a biopsychosocial model. For a certified pain management nurse, this means utilizing validated assessment tools, conducting thorough history-taking, and performing a physical examination to differentiate between nociceptive tissue damage, neuropathic nerve damage, and psychogenic psychological origin pain. Recognizing that these categories are not always mutually exclusive and can coexist is crucial. The approach that prioritizes a detailed differential diagnosis, considering all three types of pain and their potential interactions, represents best professional practice by ensuring a holistic and evidence-based evaluation. This adheres to ethical principles of beneficence and non-maleficence, by aiming for the most accurate diagnosis to guide safe and effective care. Incorrect approaches analysis. An approach that solely focuses on physical findings and dismisses the patient's subjective report as exaggerated or psychosomatic without a thorough differential diagnosis fails to acknowledge the complexity of pain perception and can lead to undertreatment. This could be considered a failure to adhere to the principle of patient-centered care, and may violate ethical guidelines that mandate treating pain as reported by the patient. An approach that immediately labels the pain as purely psychogenic, without ruling out nociceptive or neuropathic components, is premature and potentially harmful. This can lead to the patient feeling invalidated, and can result in the denial of appropriate pharmacological or interventional treatments for underlying physical causes. Ethically, this represents a failure to conduct a complete and unbiased assessment. An approach that focuses exclusively on pharmacological interventions for nociceptive pain, ignoring the possibility of neuropathic or psychogenic components, may be ineffective and lead to polypharmacy or adverse drug events. This demonstrates a lack of comprehensive diagnostic reasoning and can be considered a deviation from best practice, potentially violating the duty of care. Professional reasoning. Professionals should approach pain assessment with a framework that begins with a thorough patient history, including the onset, location, quality, intensity, duration, and aggravating/alleviating factors of the pain. This is followed by a comprehensive physical examination. Crucially, the assessment must then involve a differential diagnosis to distinguish between nociceptive, neuropathic, and psychogenic pain, or combinations thereof. This involves considering specific pain characteristics, e.g., burning, tingling for neuropathic pain, response to different treatments, and the presence of psychological distress or contributing factors. The decision-making process should be iterative, with treatment plans adjusted based on ongoing assessment and patient response, always prioritizing patient safety and well-being. Question 5. Performance analysis shows a patient presenting with widespread, persistent pain that is disproportionate to any identifiable tissue injury, accompanied by heightened sensitivity to stimuli that are not normally painful. The patient reports significant functional impairment and emotional distress related to the pain. Based on the Certified Pain Management Nurse Regulatory Framework, which of the following approaches best addresses this patient's complex presentation? Option A. Advise the patient that their pain is likely psychosomatic and recommend referral for psychiatric evaluation without further pain management interventions. Option B. Implement a multimodal treatment plan focusing on patient education about central sensitization, graded physical activity, cognitive behavioral strategies, and judicious use of non-opioid analgesics and adjuvant medications with regular reassessment. Option C. Increase the dosage of opioid analgesics to achieve adequate pain relief, as the patient's pain intensity suggests a need for stronger pharmacological intervention. Option D. Discontinue all current pain management therapies due to the lack of significant improvement and advise the patient to seek care elsewhere. The correct answer is B. Implement a multimodal treatment plan focusing on patient education about central sensitization, graded physical activity, cognitive behavioral strategies, and judicious use of non-opioid analgesics and adjuvant medications with regular reassessment. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it involves a patient exhibiting symptoms consistent with central sensitization, a complex and often misunderstood phenomenon in pain management. Accurately diagnosing and managing central sensitization requires a nuanced understanding beyond simple nociception, demanding careful assessment of subjective reporting, functional limitation, and the absence of clear peripheral tissue damage. The challenge lies in differentiating central sensitization from other pain etiologies and avoiding premature or inappropriate interventions. Correct approach analysis. The correct approach emphasizes a comprehensive, multimodal assessment and management strategy tailored to the patient's specific presentation of central sensitization. This aligns with best professional practice by acknowledging the biopsychosocial model of pain, which is fundamental in pain management nursing. Regulatory frameworks for pain management nurses, such as those outlined by the Certified Pain Management Nurse Credentialing Body, mandate a holistic approach that considers psychological and social factors alongside physical ones. This approach prioritizes patient education, non-pharmacological interventions e.g., graded exercise, cognitive behavioral therapy principles, and judicious pharmacological management, focusing on addressing the underlying mechanisms of central sensitization rather than solely symptom suppression. This aligns with ethical principles of beneficence and non-maleficence by seeking to improve the patient's quality of life and minimize harm from ineffective or overly aggressive treatments. Incorrect approaches analysis. One incorrect approach involves solely focusing on escalating opioid analgesics. This fails to address the core issue of central sensitization, where opioid efficacy is often limited and can exacerbate hyperalgesia and allodynia, leading to opioid-induced hyperalgesia. This approach violates the principle of non-maleficence by potentially worsening the patient's pain and increasing risks associated with opioid therapy, such as addiction and overdose. It also demonstrates a lack of adherence to current best practice guidelines for managing chronic pain, particularly conditions involving central sensitization. Another incorrect approach is to dismiss the patient's reported pain as purely psychological or psychosomatic without a thorough investigation. While psychological factors are integral to central sensitization, labeling the pain as solely psychological can lead to patient mistrust, feelings of invalidation, and a failure to implement appropriate pain management strategies. This can be considered a breach of ethical duty to provide compassionate care and can lead to regulatory scrutiny for inadequate patient assessment and management. A third incorrect approach is to discontinue all pain management interventions due to a perceived lack of response to initial treatments. This neglects the ongoing need for pain management and support for a patient with a chronic condition. It can lead to patient abandonment and a deterioration of their functional status and quality of life, contravening ethical obligations and professional standards of care. Professional reasoning. Professionals should approach such cases by first conducting a thorough and systematic assessment, gathering information about the pain's characteristics, impact on function, and contributing factors. This should be followed by a collaborative development of a treatment plan that incorporates evidence-based strategies, including patient education, non-pharmacological modalities, and pharmacotherapy, with regular reassessment and adjustment of the plan based on the patient's response. Decision-making should be guided by a commitment to patient-centered care, adherence to professional standards and ethical principles, and a willingness to consult with other healthcare professionals when necessary. Question 6. Compliance review shows a patient experiencing chronic neuropathic pain is reporting persistent discomfort despite receiving a consistent dose of a prescribed gabapentinoid. The nurse is considering adjusting the pain management plan. Which of the following approaches best reflects current best practices and regulatory expectations for pain management nurses? Option A. Recommend adding a non-pharmacological therapy, such as cognitive behavioral therapy or physical therapy, in conjunction with the current medication, and reassess pain levels and functional status after a defined period. Option B. Advise the patient to discontinue the gabapentinoid and try over-the-counter pain relievers instead. Option C. Document the patient's report of persistent pain but take no immediate action, waiting for the next scheduled physician visit. Option D. Increase the gabapentinoid dosage significantly without further assessment, assuming a higher dose will provide more relief. The correct answer is D. Increase the gabapentinoid dosage significantly without further assessment, assuming a higher dose will provide more relief. Explanation. This scenario presents a professional challenge due to the inherent complexity of pain modulation mechanisms and the need for individualized patient care within the strict regulatory framework governing pain management nursing. The challenge lies in translating theoretical knowledge of pain pathways and their modulation into practical, evidence-based interventions that are safe, effective, and compliant with nursing scope of practice and ethical guidelines. Accurate assessment and understanding of a patient's specific pain experience, including their unique physiological and psychological responses, are paramount. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal strategy that directly addresses the patient's reported pain and aligns with established pain management principles. This approach acknowledges that pain is a complex phenomenon influenced by various factors, and that effective management often requires a combination of pharmacological and non-pharmacological interventions. Adherence to evidence-based guidelines and a patient-centered approach ensures that care is both clinically sound and ethically responsible, respecting patient autonomy and promoting optimal outcomes. This aligns with the regulatory expectation for nurses to provide competent and ethical care, utilizing current best practices in pain management. An incorrect approach that relies solely on a single modality, such as exclusively administering opioid analgesics without considering non-pharmacological adjuncts or reassessing the patient's response, fails to meet the standard of care. This could lead to suboptimal pain relief, increased risk of adverse effects, and potential for opioid misuse or dependence, all of which are regulatory concerns. Another incorrect approach that neglects to involve the patient in treatment decisions or fails to document the rationale for interventions demonstrates a lack of patient-centered care and potential noncompliance with documentation requirements. Furthermore, ignoring patient-reported pain or dismissing their subjective experience in favor of objective findings alone is a significant ethical and professional failing, as pain is inherently subjective. Such approaches may violate professional standards of care, ethical principles of beneficence and non-maleficence, and specific regulatory mandates regarding patient assessment and treatment planning. Professional decision-making in such situations requires a systematic process. 1. Thoroughly assess the patient's pain, including its characteristics, intensity, and impact on function, utilizing validated assessment tools. 2. Review the patient's medical history, current medications, and any coexisting conditions that might influence pain or its management. 3. Consult current evidence-based guidelines and literature for recommended pain management strategies relevant to the patient's condition. 4. Develop a collaborative, individualized treatment plan with the patient, incorporating pharmacological and non-pharmacological interventions. 5. Continuously monitor the patient's response to treatment, reassessing pain levels and for adverse effects, and adjust the plan as needed. 6. Document all assessments, interventions, patient responses, and rationale for decisions meticulously. Question 7. Analysis of a patient's pain experience when they are unable to verbally communicate their discomfort presents a significant clinical challenge. Which of the following approaches best reflects a comprehensive pain assessment technique for such an individual, considering the need for accurate and ethical pain management? Option A. Administer a placebo to observe for any change in the patient's demeanor, assuming this will indicate the presence or absence of pain. Option B. Utilize a validated nonverbal pain assessment scale. Observe for behavioral cues such as guarding or restlessness, and consider physiological indicators like increased heart rate or blood pressure. Option C. Assume that stable vital signs indicate the patient is comfortable and not in pain, regardless of other observable signs. Option D. Rely solely on the absence of overt vocalizations like moaning or crying, as this suggests the patient is not experiencing significant pain. The correct answer is B. Utilize a validated nonverbal pain assessment scale. Observe for behavioral cues such as guarding or restlessness, and consider physiological indicators like increased heart rate or blood pressure. Explanation. Scenario analysis. This scenario is professionally challenging because accurately assessing pain in a nonverbal patient requires a nuanced approach that goes beyond self-report. The nurse must integrate multiple data points to infer the patient's pain experience, balancing the need for effective pain management with the risk of over- or undertreatment. The absence of verbal cues necessitates a heightened level of observational skill and critical thinking, demanding a comprehensive understanding of nonverbal pain indicators and their interpretation within the patient's specific context. Correct approach analysis. The correct approach represents best professional practice because it adheres to the principles of comprehensive pain assessment as mandated by nursing practice standards and ethical guidelines. Specifically, it emphasizes the use of validated nonverbal pain assessment tools, observation of behavioral cues, and consideration of physiological indicators. This multimodal strategy ensures a more objective and reliable estimation of pain in individuals unable to articulate their experience. Such an approach aligns with the ethical imperative to alleviate suffering and promote patient well-being, even when direct communication is not possible. Regulatory frameworks for nursing practice universally require nurses to assess pain effectively, and this method provides the most robust framework for doing so in challenging situations. Incorrect approaches analysis. One incorrect approach involves relying solely on the absence of grimacing or moaning. This is a failure because pain can manifest in numerous subtle ways, and the absence of these specific behaviors does not equate to the absence of pain. This approach is ethically deficient as it risks undertreating pain, violating the duty of care. It also fails to meet regulatory requirements for thorough pain assessment. Another incorrect approach is to assume that a stable vital sign reading indicates no pain. This is problematic because physiological responses to pain can be highly variable and may not always be reflected in standard vital sign measurements, especially in patients with chronic conditions or those who have become accustomed to a certain level of discomfort. This approach is professionally unsound and ethically questionable due to the potential for inadequate pain relief. A third incorrect approach is to administer a placebo to gauge pain levels. This is a significant ethical and regulatory violation. Administering a placebo without the patient's informed consent is deceptive and erodes the trust essential to the nurse-patient relationship. It also fails to provide a valid assessment of actual pain and can delay appropriate analgesic administration. Regulatory bodies and ethical codes strictly prohibit such practices. Professional reasoning. Professionals should approach nonverbal pain assessment by first recognizing the limitations of direct self-report. The decision-making process involves systematically gathering data from multiple sources, observing behavioral indicators, e.g., restlessness, guarding, changes in posture, assessing physiological signs, while acknowledging their limitations, and utilizing validated nonverbal pain assessment scales. Crucially, this process must be individualized, considering the patient's baseline behavior, underlying condition, and any known factors that might influence pain perception or expression. When in doubt, it is always more ethically sound to err on the side of providing pain relief, with careful monitoring for efficacy and side effects, rather than withholding treatment due to an uncertain assessment. Question 8. Operational review demonstrates a need to standardize pain assessment practices across a diverse patient population, including adults with varying cognitive abilities and pediatric patients. Which approach to selecting and implementing pain measurement tools best aligns with current certified pain management nurse practice standards and regulatory expectations for comprehensive pain assessment? Option A. Implement a single, validated numerical rating scale, NRS, for all adult patients and a Wong-Baker Faces Pain Rating Scale for all pediatric patients, with staff trained on their administration. Option B. Mandate the use of the most recently published pain assessment tool, regardless of its validation for specific patient populations or its ease of integration into existing workflows. Option C. Develop a protocol that guides the selection of pain measurement tools based on patient age, cognitive status, and communication abilities, utilizing a range of validated scales, e.g., NRS, Visual Analog Scale, Verbal Descriptor Scale, FLAC Scale, and ensuring ongoing staff competency. Option D. Rely primarily on nurses' clinical judgment and informal patient reports to gauge pain intensity, supplementing with a chosen scale only when deemed necessary by the individual nurse. The correct answer is A. Implement a single validated numerical rating scale, NRS, for all adult patients and a Wong-Baker Faces Pain Rating Scale for all pediatric patients, with staff trained on their administration. Explanation. This scenario presents a common challenge in pain management, selecting the most appropriate assessment tool for a diverse patient population. The professional challenge lies in balancing the need for objective, quantifiable data with the subjective nature of pain and the varying cognitive and communication abilities of patients. Careful judgment is required to ensure that the chosen tool accurately reflects the patient's pain experience, guides effective treatment, and meets regulatory standards for documentation and care. The correct approach involves a systematic evaluation of available pain scales, considering their psychometric properties, applicability to different patient groups, e.g., adults, children, those with cognitive impairment, and alignment with established clinical guidelines and institutional policies. Best professional practice dictates using validated tools that are sensitive to changes in pain intensity and quality, and that can be reliably administered and interpreted by the nursing team. This aligns with ethical obligations to provide competent and patient-centered care, ensuring that pain is adequately assessed and managed. Regulatory frameworks, such as those governing nursing practice and healthcare documentation, implicitly require the use of appropriate and effective assessment methods to ensure quality of care and patient safety. An incorrect approach would be to rely on a single, universally applied pain scale without considering patient-specific factors. For example, using a numerical rating scale, NRS, for a patient with severe aphasia or significant cognitive impairment would likely yield inaccurate data, failing to capture their true pain experience. This represents a failure in professional judgment and potentially a violation of the ethical principle of beneficence, as it could lead to undertreatment of pain. Similarly, exclusively using a verbal descriptor scale, VDS, for a nonverbal patient would be inappropriate and could result in a misinterpretation of their pain. Relying on informal observations or patients' families' reports without attempting a structured assessment, while sometimes supplementary, is not a substitute for a validated pain measurement tool and could lead to inconsistent and unreliable pain documentation, potentially contravening documentation standards. The professional decision-making process for similar situations should involve 1. Identifying the patient's characteristics relevant to pain assessment: age, cognitive status, communication abilities, cultural background. 2. Reviewing available pain assessment tools and their suitability for the identified patient characteristics. 3. Consulting institutional policies and evidence-based guidelines for pain management. 4. Selecting the most appropriate tool, S, and ensuring consistent application by the healthcare team. 5. Regularly reassessing the effectiveness of the chosen tool and adapting as needed. Question 9. Market research demonstrates that patients often struggle to articulate the full impact of chronic pain on their lives beyond a simple intensity score. A certified pain management nurse is assessing a patient experiencing persistent lower back pain that limits their ability to work, engage in hobbies, and maintain social relationships. Which of the following approaches best captures the functional assessment of this patient's pain impact? Option A. Relying solely on the patient's verbal description of pain intensity without inquiring about specific functional limitations. Option B. Administering a validated questionnaire that assesses pain's interference with daily activities, sleep, mood, and work, alongside a numerical pain rating scale. Option C. Observing the patient's posture and gait for signs of discomfort without asking about their daily life activities. Option D. Primarily focusing on the patient's ability to perform simple range of motion exercises during the physical examination. The correct answer is B. Administering a validated questionnaire that assesses pain's interference with daily activities, sleep, mood, and work, alongside a numerical pain rating scale. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified pain management nurse to move beyond simply quantifying pain intensity to understanding its pervasive impact on a patient's life. The challenge lies in synthesizing subjective patient reports with objective observations and functional limitations to create a holistic picture of pain's influence. This requires careful judgment to avoid oversimplification or overlooking critical aspects of the patient's experience. Correct approach analysis. The correct approach represents best professional practice because it aligns with the ethical and regulatory imperative to provide patient-centered care. A comprehensive functional assessment, which includes evaluating the impact of pain on daily activities, social engagement, and psychological well-being, is crucial for developing an individualized and effective pain management plan. This approach respects the patient's autonomy and promotes their quality of life by addressing the multifaceted nature of pain, as mandated by professional nursing standards and guidelines that emphasize holistic patient care and functional outcomes. Incorrect approaches analysis. One incorrect approach involves solely relying on a numerical pain rating scale, e.g., 0-10, without further exploration. This fails to capture the subjective experience and functional limitations associated with pain, potentially leading to an incomplete understanding of the patient's needs and an inadequate treatment plan. Ethically, this approach neglects the patient's holistic well-being and may violate professional standards that advocate for comprehensive pain assessment. Another incorrect approach is to focus exclusively on the physiological manifestations of pain, such as muscle guarding or grimacing, while disregarding the patient's self-reported functional limitations. While physical signs are important, they do not fully represent the impact of pain on a patient's ability to perform daily tasks or engage in meaningful activities. This narrow focus can lead to a misdiagnosis or undertreatment of pain's functional consequences, potentially contravening regulatory requirements for thorough patient evaluation. A third incorrect approach is to assume that a patient's ability to perform a specific task, even with reported pain, indicates a lack of significant functional impairment. This overlooks the potential for compensatory strategies, increased effort, or reduced quality of performance that may not be immediately apparent. Such an assumption can lead to a dismissal of the patient's subjective experience and a failure to identify underlying functional deficits, which is ethically problematic and may not meet the standards of care for pain management. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a comprehensive, patient-centered assessment. This involves actively listening to the patient's subjective reports, observing their functional capabilities and limitations, and considering the psychological and social impact of their pain. The process should involve integrating these various data points to inform the development of a personalized and evidence-based pain management strategy that aims to improve both pain control and functional capacity. This systematic approach ensures that all relevant aspects of the patient's experience are considered, leading to more effective and ethical care. Question 10. Research into the optimal selection of analgesics for neuropathic pain in a patient with a history of renal insufficiency and opioid intolerance necessitates a nuanced understanding of drug mechanisms. Which of the following approaches best reflects a process optimization strategy for this complex clinical scenario? Option A. Administering a broad-spectrum opioid analgesic at the lowest effective dose, assuming that all opioids share similar mechanisms and will be tolerated despite the patient's history. Option B. Selecting a medication based on its rapid onset of action, as immediate pain relief is the primary goal, regardless of the drug's specific mechanism or potential impact on renal function. Option C. Relying on the most frequently prescribed over-the-counter pain relievers, as they are generally safe and widely available, without specific consideration for their mechanism of action in neuropathic pain. Option D. Prioritizing medications that directly modulate ion channels or neurotransmitter reuptake, considering their established efficacy in neuropathic pain and the need for dose adjustments or alternative agents due to renal impairment. The correct answer is D. Prioritizing medications that directly modulate ion channels or neurotransmitter uptake, considering their established efficacy in neuropathic pain and the need for dose adjustments or alternative agents due to renal impairment. Explanation: this scenario is professionally challenging because it requires the certified pain management nurse to critically evaluate different pharmacological approaches to pain management, considering not only efficacy, but also the underlying mechanisms of action and potential patient-specific factors. The nurse must navigate the complexities of drug interactions, patient comorbidities, and the evolving understanding of pain physiology to optimize treatment outcomes while adhering to professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes a thorough understanding of the pharmacological mechanisms of action of various pain medications. This deep understanding allows for the selection of agents that target specific pain pathways, thereby maximizing therapeutic benefit and minimizing adverse effects. It aligns with the ethical imperative to provide patient-centered care, ensuring that treatment decisions are evidence-based and tailored to the individual's needs. Furthermore, it supports the professional responsibility to stay current with advancements in pain management pharmacology, which is crucial for safe and effective practice. An incorrect approach that focuses solely on the most commonly prescribed medications without considering their mechanisms of action fails to acknowledge the diverse etiologies of pain and the potential for differential drug responses. This can lead to suboptimal pain control and an increased risk of adverse events, violating the principle of beneficence. Another incorrect approach that prioritizes speed of onset over understanding the mechanism of action overlooks the importance of long-term management and potential for tolerance or dependence, potentially leading to a failure to adequately address the patient's underlying pain condition. An approach that relies on anecdotal evidence or patient preference without a scientific basis for the chosen medication's mechanism of action is ethically unsound and professionally negligent, as it deviates from evidence-based practice and could result in harm. Professional decision-making in similar situations should involve a systematic process. 1. Comprehensive patient assessment to identify pain characteristics, contributing factors, and comorbidities. 2. Review of the patient's current medication regimen for potential interactions. 3. Consideration of the pain etiology and the most appropriate pharmacological targets based on established mechanisms of action. 4. Selection of medications with a clear understanding of their pharmacodynamics and pharmacokinetics. 5. Development of a treatment plan that includes monitoring for efficacy and adverse effects, with provisions for adjustment based on patient response. 6. Ongoing patient education regarding medication use, expected outcomes, and potential side effects. Question 11. The efficiency study reveals that a significant number of patients receiving opioid therapy for chronic non-cancer pain are experiencing suboptimal pain management and increased risk of adverse events. As a certified pain management nurse, which of the following approaches best aligns with current regulatory frameworks and guidelines for opioid prescribing in this context? Option A. Implementing a standardized, one-size-fits-all opioid titration schedule for all patients based on their reported pain intensity, without further individual risk stratification or ongoing monitoring protocols. Option B. Prioritizing the immediate reduction of opioid dosage for all patients to minimize potential risks, even if it leads to a significant increase in their reported pain and functional limitations. Option C. Conducting a thorough individualized assessment of each patient's pain, functional status, and risk factors for opioid use disorder and diversion, developing a collaborative treatment plan with clear goals and monitoring strategies, and regularly reviewing PDMP data. Option D. Relying solely on the patient's subjective report of pain to determine opioid dosage adjustments, without incorporating objective measures of function or a formal risk assessment for misuse. The correct answer is A. Implementing a standardized, one-size-fits-all opioid titration schedule for all patients based on their reported pain intensity, without further individual risk stratification or ongoing monitoring protocols. Explanation: this scenario presents a common challenge in pain management, balancing the need for effective pain relief with the imperative to mitigate the risks associated with opioid therapy, particularly in the context of evolving regulatory guidelines. The certified pain management nurse must navigate patient autonomy, clinical judgment, and strict adherence to prescribing laws. The core of the challenge lies in interpreting and applying the nuanced requirements of opioid prescribing guidelines, which often involve risk assessment, patient education, and monitoring strategies. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's pain, functional status, and risk factors for opioid misuse or diversion. This aligns with the fundamental principles of patient-centered care and the regulatory framework's emphasis on responsible opioid prescribing. Specifically, it reflects the requirement to establish a legitimate medical purpose for the prescription, educate the patient on the risks and benefits, and to implement appropriate monitoring to ensure safe and effective treatment while minimizing harm. This approach is ethically sound, promoting patient well-being and public safety. An incorrect approach that focuses solely on the patient's subjective report of pain without a thorough risk assessment fails to meet the regulatory requirement for a documented medical necessity and a plan to manage potential harms. This could lead to inappropriate prescribing, increasing the risk of adverse events, addiction, or diversion. Another incorrect approach that relies on a standardized protocol without considering individual patient factors neglects the principle of individualized care and may overlook specific contraindications or risk factors unique to the patient, violating the spirit and letter of prescribing guidelines. Finally, an approach that prioritizes rapid symptom relief over long-term safety and adherence to monitoring requirements disregards the comprehensive nature of responsible opioid prescribing and the legal obligations to prevent misuse. Professionals should employ a systematic decision-making process that begins with a thorough patient evaluation, including a detailed history, physical examination, and assessment of pain characteristics and impact on function. This should be followed by a comprehensive risk assessment for opioid use disorder and other adverse outcomes. Based on this assessment, a treatment plan should be developed collaboratively with the patient, clearly outlining goals, expected outcomes, potential risks and benefits, and the patient's responsibilities. Ongoing monitoring, including regular reassessments of pain, function, and adherence to the treatment plan, is crucial, along with periodic review of prescription drug monitoring program, PDMP data where applicable, to ensure the continued appropriateness and safety of opioid therapy. Question 12. Market research demonstrates a growing interest among pain management clinics in adopting intrathecal drug delivery systems for patients with refractory chronic pain. A clinic is considering implementing this technology, but faces challenges in establishing standardized protocols for patient selection, device management, and ongoing patient education. Which of the following approaches best addresses these implementation challenges while adhering to regulatory and ethical standards for certified pain management nurses? Option A. Delegate the majority of patient screening and ongoing management responsibilities to primary care physicians, with the pain management team providing only initial device setup and troubleshooting. Option B. Implement the system using existing general nursing protocols for medication administration, without developing specific guidelines for intrathecal drug delivery systems, to streamline the adoption process. Option C. Develop a multidisciplinary team protocol that includes rigorous patient screening for appropriate candidacy, standardized device programming and maintenance procedures performed by credentialed personnel, and comprehensive patient and caregiver education on system use, potential complications, and emergency protocols. Option D. Prioritize rapid implementation by focusing primarily on efficient device programming and dispensing, assuming that most patients referred for intrathecal therapy are already well-informed and suitable candidates. The correct answer is C. Develop a multidisciplinary team protocol that includes rigorous patient screening for appropriate candidacy, standardized device programming and maintenance procedures performed by credentialed personnel, and comprehensive patient and caregiver education on system use, potential complications, and emergency protocols. Explanation. This scenario presents a common implementation challenge in pain management, ensuring safe and effective patient care when introducing a new technology like intrathecal drug delivery systems. The professional challenge lies in balancing the potential benefits of advanced pain relief with the inherent risks and complexities associated with these systems, particularly in a regulated environment. Careful judgment is required to navigate patient selection, device management, and ongoing monitoring, all while adhering to established standards of care and regulatory mandates. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary, and patient-centered strategy. This involves thorough patient assessment to identify appropriate candidates, meticulous device programming and management by qualified personnel, and robust ongoing monitoring and education. This aligns with regulatory frameworks that emphasize patient safety, evidence-based practice, and the need for specialized expertise in managing complex medical devices and treatments. Ethical considerations of beneficence and non-maleficence are directly addressed by ensuring that the benefits of the therapy outweigh the risks and that potential complications are proactively managed. An incorrect approach that focuses solely on the technical aspects of programming without adequate patient assessment or ongoing support fails to meet the standard of care. This could lead to inappropriate patient selection, adverse drug events, or device malfunction, all of which represent regulatory and ethical failures. Similarly, an approach that delegates management to inadequately trained staff or neglects comprehensive patient and caregiver education risks patient harm and violates professional accountability. Regulatory bodies mandate that healthcare professionals operate within their scope of practice and ensure that all personnel involved in patient care are competent. Failure to provide adequate patient education also constitutes an ethical breach, as informed consent and patient autonomy are compromised. The professional decision-making process for similar situations should involve a systematic evaluation of patient suitability, a clear understanding of the technology's capabilities and limitations, and a commitment to ongoing professional development. This includes consulting relevant clinical guidelines, engaging in interdisciplinary collaboration, and prioritizing patient safety and education at every stage of care. Question 13. Which approach would be most appropriate for a certified pain management nurse to integrate non-pharmacological adjuncts into a patient's medication-based pain management plan, considering the impact on overall pain control and patient well-being? Option A. Introducing a non-pharmacological adjunct that requires significant patient effort or lifestyle changes, without assessing the patient's readiness, resources, or potential barriers to adherence, and without providing comprehensive education. Option B. Suggesting a novel or experimental non-pharmacological technique that has limited research support but is perceived as potentially beneficial by the patient, without verifying its safety or efficacy in conjunction with prescribed medications. Option C. Recommending a non-pharmacological adjunct that has demonstrated efficacy in research for similar pain conditions after a comprehensive patient assessment, and confirming its compatibility with the patient's current pharmacological regimen through interdisciplinary consultation. Option D. Implementing a widely recognized non-pharmacological therapy based on its general effectiveness for pain, without a detailed patient-specific assessment or consideration of current medications. Correct answer is D. Implementing a widely recognized non-pharmacological therapy based on its general effectiveness for pain, without a detailed patient-specific assessment or consideration of current medications. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pain management nurse to integrate non-pharmacological interventions into a patient's complex pain management plan, balancing efficacy, patient preference, and adherence. The challenge lies in selecting the most appropriate adjunct that complements pharmacological treatment without causing undue burden or interfering with prescribed medications, all while adhering to established nursing standards and patient-centered care principles. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's pain experience, including its impact on daily function, psychological state, and previous responses to various therapies. This assessment informs the selection of non-pharmacological adjuncts that are evidence-based, tailored to the individual's needs and preferences, and integrated synergistically with their medication regimen. This aligns with the ethical imperative of providing individualized, holistic care and the professional responsibility to utilize best practices in pain management, as outlined by nursing professional organizations and regulatory bodies that emphasize patient outcomes and safety. The focus is on enhancing the effectiveness of pain management while minimizing reliance on or side effects of pharmacological agents. Incorrect approaches analysis. One incorrect approach would be to recommend a non-pharmacological adjunct solely based on its popularity or anecdotal success in other patients, without a thorough, individual assessment. This fails to meet the standard of individualized care and could lead to an ineffective or even detrimental intervention, potentially causing patient frustration and non-adherence. Ethically, this disregards the patient's unique needs and preferences. Another incorrect approach would be to suggest an adjunct that has known contraindications or interactions with the patient's current pharmacological pain management plan, without consulting the prescribing physician. This poses a direct risk to patient safety and violates the nurse's duty of care. Regulatory frameworks mandate collaboration and communication among healthcare providers to ensure patient safety and coordinated care. A third incorrect approach would be to implement a non-pharmacological adjunct without adequate patient education on its purpose, expected benefits, and proper usage. This can lead to poor adherence, misunderstanding of outcomes, and a perception that the intervention is ineffective, undermining the overall pain management strategy. Professional nursing practice requires thorough patient education to empower patients in their care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment. This includes understanding the patient's pain characteristics, functional limitations, psychological factors, and previous treatment responses. Next, they should consult evidence-based guidelines and research to identify appropriate non-pharmacological adjuncts that align with the patient's specific needs and the established pharmacological plan. Collaboration with the interdisciplinary team, including physicians and therapists, is crucial to ensure a coordinated and safe approach. Finally, patient preferences and values must be integrated into the decision-making process, ensuring shared decision-making and promoting adherence. Question 14. The review process indicates a need to evaluate new technological solutions for pain assessment. A pain management nurse is considering adopting a novel wearable device that claims to objectively measure physiological indicators of pain. Which of the following approaches to evaluating this technology best aligns with current professional standards and ethical considerations for pain management nursing? Option A. Prioritize the device based on its low acquisition cost and the manufacturer's promotional materials highlighting its advanced features, assuming it will be a valuable addition to the practice. Option B. Focus solely on the device's ability to reduce the time nurses spend on pain assessment, as efficiency is the primary driver for adopting new technologies in healthcare. Option C. Systematically review peer-reviewed literature for studies validating the device's accuracy, reliability, and clinical utility in diverse patient populations, and consider its integration into a comprehensive assessment protocol that still includes subjective patient reporting. Option D. Implement the device immediately for all patients, relying on the assumption that any technological advancement in pain assessment is inherently beneficial and will improve patient outcomes. Correct answer is C. Systematically review peer-reviewed literature for studies validating the device's accuracy, reliability, and clinical utility in diverse patient populations, and consider its integration into a comprehensive assessment protocol that still includes subjective patient reporting. Explanation. The review process indicates a common challenge in pain management nursing: the integration of new technologies into patient assessment. This scenario is professionally challenging because it requires nurses to critically evaluate the efficacy, reliability, and ethical implications of various technological tools, ensuring patient safety and adherence to evolving standards of care. The nurse must balance the potential benefits of technology with the fundamental principles of patient-centered care and evidence-based practice. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of technology before widespread adoption. This aligns with the ethical imperative to provide competent care and the regulatory expectation that nurses practice within their scope and utilize tools that are validated and appropriate for the patient population. Specifically, it upholds the principle of beneficence by ensuring that adopted technologies genuinely improve patient outcomes and do not introduce undue risks or burdens. Furthermore, it adheres to professional standards that mandate continuous learning and the critical appraisal of new interventions. An incorrect approach that relies solely on anecdotal evidence or marketing claims fails to meet the standard of evidence-based practice. This can lead to the adoption of ineffective or even harmful technologies, violating the principle of non-maleficence. Such an approach also risks non-compliance with regulatory guidelines that may require documented validation of assessment tools. Another incorrect approach, focusing exclusively on cost-effectiveness without considering clinical utility or patient impact is ethically problematic. While resource management is important, patient well-being must be the primary consideration. This approach could lead to the selection of cheaper, less accurate technologies, compromising the quality of pain assessment and potentially leading to suboptimal pain management, which is a failure of the nurse's duty of care. A further incorrect approach that neglects patient comfort and usability of the technology overlooks the patient's experience and autonomy. Pain assessment technologies should enhance, not hinder, the patient's ability to communicate their pain. Ignoring these factors can lead to patient dissatisfaction, reduced engagement in their care, and potentially inaccurate self-reporting, all of which are detrimental to effective pain management. The professional decision-making process for similar situations should involve a multifaceted evaluation. This includes 1. Identifying a clinical need or opportunity for technological enhancement. 2. Conducting a thorough literature review to assess the evidence supporting the technology's efficacy and reliability. 3. Considering the technology's usability, patient comfort, and potential for bias. 4. Evaluating the cost-benefit ratio in conjunction with clinical impact. 5. Consulting with interdisciplinary teams and seeking expert opinions. And 6. Piloting the technology with clear evaluation metrics before full implementation, ensuring alignment with all relevant professional standards and regulatory requirements. Question 15. The analysis reveals a 68-year-old patient with a history of chronic kidney disease, CKD stage 3, and a recent diagnosis of diabetic neuropathy experiencing persistent neuropathic pain. The patient is currently taking warfarin for atrial fibrillation and metformin for diabetes. The nurse practitioner is considering initiating an adjuvant medication to manage the neuropathic pain. Which of the following approaches best aligns with safe and effective pain management principles for this patient? Option A. Initiate amitriptyline as standard starting dose, as it is a well-established first-line agent for neuropathic pain, without specific consideration for the patient's CKD or warfarin use. Option B. Prescribe pregabalin at a typical starting dose, assuming it will be effective for neuropathic pain, and deferring any specific renal dose adjustments or interaction checks until the patient reports issues. Option C. Prescribe gabapentin, starting at a low dose and titrating slowly, with careful monitoring for central nervous system side effects and dose adjustments based on renal function. Option D. Recommend duloxetine, given its dual mechanism of action for both neuropathic pain and depression, without assessing for potential interactions with warfarin or the patient's renal status. Correct answer is C. Prescribe gabapentin, starting at a low dose and titrating slowly, with careful monitoring for central nervous system side effects and dose adjustments based on renal function. Explanation. The analysis reveals a common clinical challenge in pain management: optimizing adjuvant medication selection for neuropathic pain while navigating patient-specific factors and potential drug interactions. This scenario is professionally challenging because it requires a nuanced understanding of pharmacodynamics, pharmacokinetics, and the individual patient's comorbidities, previous treatment responses, and current medication regimen. A failure to consider these elements can lead to suboptimal pain relief, increased adverse events, and potential contraindications, all of which impact patient safety and quality of care. The correct approach represents best professional practice because it prioritizes a comprehensive patient assessment and evidence-based guideline adherence. This involves a thorough review of the patient's medical history, including renal and hepatic function, potential drug-drug interactions with existing medications, e.g., anticoagulants, other CNS depressants, and a history of adverse reactions to psychotropic medications. Selecting an antidepressant or anticonvulsant with a favorable safety profile for the patient's specific comorbidities, initiating at a low dose, and titrating slowly while monitoring for efficacy and side effects, aligns with the principles of safe and effective pain management as outlined by professional nursing organizations and regulatory bodies governing advanced practice nursing. This approach emphasizes individualized care and risk mitigation. An incorrect approach that involves selecting an antidepressant without considering the patient's history of cardiac arrhythmias would be a significant regulatory and ethical failure. This is because it demonstrates a disregard for patient safety and a failure to adhere to the principle of do no harm. Such an action could lead to serious adverse cardiac events, violating professional standards of care and potentially leading to disciplinary action. Another incorrect approach, such as prescribing an anticonvulsant known to have significant cognitive side effects to a patient with pre-existing dementia, would also be ethically and regulatorily unacceptable. This demonstrates a lack of patient-centered care and a failure to consider the impact of medication on the patient's overall functional status and quality of life. Furthermore, failing to document the rationale for medication selection and the patient's response would be a breach of professional record-keeping standards, hindering continuity of care and accountability. Professional decision-making in these situations should follow a systematic process. 1. Thoroughly assess the patient's pain characteristics, comorbidities, and current medications. 2. Consult current, evidence-based guidelines for neuropathic pain management, paying attention to recommended adjuvant medications and their contraindications. 3. Evaluate the patient's individual risk factors and potential for drug interactions. 4. Select an appropriate adjuvant medication based on the assessment and guidelines, considering the most favorable safety and efficacy profile for that specific patient. 5. Initiate the medication at the lowest effective dose and titrate gradually, closely monitoring for therapeutic response and adverse effects. 6. Document all assessments, decisions, and patient responses meticulously. Question 16. The monitoring system demonstrates a sustained decrease in the patient's blood pressure and a slight increase in heart rate following a recent femoral nerve block for acute knee pain. The patient reports feeling a bit lightheaded but denies any new or increased pain. What is the most appropriate immediate nursing action? Option A. Document the findings and continue to monitor the patient, assuming the changes are transient and benign. Option B. Increase the infusion rate of the patient's intravenous fluids to counteract the hypotension. Option C. Immediately notify the supervising physician of the findings and patient's subjective report and prepare for potential interventions as directed. Option D. Administer a prescribed rescue medication for hypotension without further consultation. Correct answer is C. Immediately notify the supervising physician of the findings and patient's subjective report and prepare for potential interventions as directed. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's pain management plan, involving a nerve block, requires adjustment due to an unexpected physiological response. The nurse must rapidly assess the situation, interpret the monitoring data, and determine the most appropriate intervention while adhering to established protocols and ensuring patient safety. The challenge lies in distinguishing between a normal physiological variation and a potential complication, and in selecting an intervention that is both effective and safe within the scope of practice for a certified pain management nurse. Correct approach analysis. The correct approach prioritizes immediate, direct patient assessment and communication with the supervising physician. This aligns with best professional practice by ensuring that any intervention is based on direct clinical observation and expert medical guidance. Regulatory frameworks for advanced practice nursing, such as those governing certified pain management nurses, emphasize the importance of a collaborative approach with physicians, especially when managing complex interventions like nerve blocks and responding to potential adverse events. This approach upholds the ethical principle of beneficence by ensuring the patient receives timely and appropriate care, and the principle of non-maleficence by avoiding potentially harmful interventions without proper medical oversight. It also adheres to guidelines that mandate clear communication channels and escalation protocols for patient care. Incorrect approaches analysis. One incorrect approach involves solely relying on the monitoring system's alerts without direct patient assessment. This is a regulatory and ethical failure because it bypasses the critical step of clinical correlation. Monitoring systems provide data, but a nurse's clinical judgment, informed by direct patient observation, vital signs, neurological status, pain assessment, is essential for accurate interpretation. This approach could lead to misdiagnosis or delayed appropriate treatment, violating the duty of care. Another incorrect approach is to independently adjust the nerve block medication dosage or administer a new medication without physician consultation. This represents a significant scope of practice violation and a failure to adhere to collaborative practice agreements and physician oversight requirements. Certified pain management nurses operate under specific protocols and physician direction for such interventions. Unauthorized independent action can lead to patient harm and constitutes professional misconduct, potentially violating state nursing board regulations and facility policies. A further incorrect approach is to dismiss the monitoring system's findings as insignificant without further investigation or consultation. This demonstrates a failure to exercise due diligence and a potential disregard for patient safety. Even subtle changes indicated by monitoring can be precursors to serious complications. Ethically, this approach fails to uphold the principle of vigilance and proactive patient care. Regulatory guidelines mandate that nurses report and investigate any deviations from baseline or expected patient responses. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the patient and the available data. This involves 1. Recognizing and interpreting the significance of the monitoring system's output in the context of the patient's baseline and the nerve block procedure. 2. Performing a direct, hands-on patient assessment to gather subjective and objective data. 3. Communicating findings and concerns clearly and concisely to the supervising physician. 4. Collaborating with the physician to develop and implement an appropriate plan of care, which may include further diagnostic tests, medication adjustments, or other interventions. 5. Documenting all assessments, communications, and interventions meticulously. This framework ensures that decisions are evidence-based, patient-centered, and compliant with professional standards and regulatory requirements. Question 17. The monitoring system demonstrates a sudden, transient drop in the patient's blood pressure and a slight increase in heart rate following the administration of a local anesthetic during a planned epidural steroid injection. The patient appears slightly diaphoretic but denies any acute pain. What is the most appropriate immediate nursing action? Option A. Administer supplemental oxygen and notify the physician of the observed changes. Option B. Document the findings and wait to see if the patient's condition stabilizes on its own. Option C. Increase the rate of the patient's intravenous fluid infusion without further assessment. Option D. Reassure the patient that these changes are common and continue with the procedure as planned. The correct answer is A. Administer supplemental oxygen and notify the physician of the observed changes. Explanation. Scenario analysis. This scenario presents a common challenge in interventional pain management where a patient's physiological response to a procedure deviates from the expected norm. The nurse must quickly assess the situation, differentiate between a normal physiological variation and a potential complication, and initiate appropriate interventions while adhering to established protocols and patient safety standards. The challenge lies in the rapid interpretation of subtle cues and the timely escalation of care to prevent adverse outcomes. Correct approach analysis. The correct approach prioritizes immediate patient assessment and intervention based on the observed physiological changes. This aligns with the fundamental ethical and regulatory principles of patient advocacy and the duty to provide safe, competent care. Prompt recognition of potential distress and the initiation of supportive measures, such as administering oxygen and notifying the physician, are critical steps in managing emergent situations and preventing patient harm. This proactive stance is mandated by professional nursing standards and regulatory bodies that emphasize timely and effective response to patient deterioration. Incorrect approaches analysis. One incorrect approach involves delaying intervention due to a belief that the observed changes are within the patient's normal variability without a thorough assessment. This failure to act promptly constitutes a breach of the nursing standard of care and could violate regulations requiring nurses to monitor patients and respond to changes in their condition. It demonstrates a lack of critical thinking and a disregard for patient safety. Another incorrect approach is to solely rely on the physician's prior assessment without re-evaluating the patient's current status. Physician input is crucial. The nurse has an independent responsibility to monitor the patient and report any new or worsening symptoms. This approach neglects the nurse's role in continuous patient assessment and can lead to missed or delayed diagnosis of complications. A third incorrect approach is to dismiss the observed changes as insignificant without further investigation or consultation. This demonstrates a failure to recognize the potential seriousness of physiological deviations in the context of interventional pain management, where complications can arise rapidly. It violates the principle of due diligence and the expectation that nurses will exercise sound clinical judgment. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with a comprehensive evaluation of vital signs and patient presentation. This should be followed by a critical analysis of the findings in the context of the patient's medical history, the procedure performed, and expected physiological responses. When deviations occur, nurses should utilize their knowledge base and clinical judgment to determine the most appropriate course of action, which may include initiating immediate interventions, consulting with colleagues, or escalating care to the physician. Adherence to institutional policies and procedures, as well as relevant professional standards and regulations, is paramount in ensuring patient safety and optimal outcomes. Question 18. During the evaluation of a patient presenting with persistent discomfort, which assessment approach most effectively differentiates between acute and chronic pain, thereby guiding appropriate management strategies? Option A. A comprehensive assessment that integrates subjective patient reports of pain characteristics and functional impact with objective clinical findings and a detailed pain history, considering the duration and nature of the pain. Option B. An assessment focused solely on the patient's current numerical pain rating, assuming higher scores indicate more severe pain requiring immediate aggressive intervention. Option C. An assessment that prioritizes objective diagnostic imaging results, using them as the primary determinant of pain severity and type. Option D. An assessment that relies exclusively on the patient's description of the pain's quality, e.g., sharp, dull, burning, without exploring its onset, duration, or impact on daily activities. The correct answer is A. A comprehensive assessment that integrates subjective patient reports of pain characteristics and functional impact with objective clinical findings and a detailed pain history, considering the duration and nature of the pain. Explanation. Scenario analysis. Differentiating between acute and chronic pain is a cornerstone of effective pain management, yet it presents a significant clinical challenge. Acute pain is typically a symptom of an underlying injury or illness, serving as a warning signal, and is expected to resolve as the underlying cause heals. Chronic pain, conversely, persists beyond the expected healing period, often becoming a disease state in itself, with complex biopsychosocial factors contributing to its perpetuation. Misinterpreting the nature of pain can lead to inappropriate treatment strategies, potentially exacerbating the patient's suffering, delaying recovery, or even causing harm. Challenge lies in gathering comprehensive subjective and objective data, considering the patient's history, and applying clinical judgment to accurately categorize the pain, which directly impacts the subsequent management plan and adherence to regulatory standards for patient care. Correct approach analysis. The correct approach involves a comprehensive assessment that meticulously gathers subjective patient reports of pain characteristics, onset, duration, quality, intensity, aggravating/alleviating factors, and objective findings, physical examination, diagnostic tests, functional limitations. This holistic evaluation is crucial because it allows the certified pain management nurse to identify patterns indicative of acute pain, e.g., sudden onset, clear precipitating event, expected resolution, versus chronic pain, e.g., long duration, diffuse or nonspecific symptoms, significant impact on mood, sleep, and function, often with less clear precipitating events. This detailed assessment aligns with regulatory requirements for thorough patient evaluation and the ethical imperative to provide individualized, evidence-based care. By distinguishing between acute and chronic pain, the nurse can select appropriate interventions, such as immediate analgesia and treatment of the underlying cause for acute pain, or a multidisciplinary approach involving pharmacologic, non-pharmacologic, and psychological interventions for chronic pain, thereby optimizing patient outcomes and adhering to professional standards of practice. Incorrect approaches analysis. Focusing solely on the patient's current pain intensity without considering its duration or the presence of a clear, ongoing precipitating cause is an incomplete assessment. This approach risks misclassifying chronic pain as acute, leading to potentially ineffective or even harmful treatments that do not address the underlying chronicity and its associated biopsychosocial components. This failure to conduct a comprehensive assessment violates regulatory mandates for thorough patient evaluation and ethical principles of beneficence and non-maleficence. Relying exclusively on objective findings like diagnostic imaging results without adequately incorporating the patient's subjective experience of pain is also problematic. While objective data is important, pain is a subjective experience. Chronic pain, in particular, can exist with minimal objective findings or be disproportionate to them. Ignoring the patient's report can lead to undertreatment or misdiagnosis, failing to meet the patient's needs, and potentially violating standards of care that emphasize patient-centered assessment. Prioritizing the patient's self-reported pain score above all other assessment data without exploring the context, duration, or impact on function is insufficient. While pain scores are a vital component, they are only one piece of the puzzle. A high pain score in the absence of other indicators of acute pathology might suggest chronic pain, and vice versa. This narrow focus can lead to inappropriate treatment decisions, failing to address the full spectrum of the patient's pain experience and its underlying mechanisms, thereby falling short of professional and regulatory expectations for comprehensive pain assessment. Professional reasoning. Professionals should employ a systematic, multifaceted approach to pain assessment. This involves actively listening to the patient's narrative, utilizing validated pain assessment tools that capture intensity, quality, and functional impact, and correlating subjective reports with objective clinical findings. The decision-making process should involve a continuous cycle of assessment, intervention, and reassessment, always considering the temporal characteristics of the pain and its impact on the patient's overall well-being. When in doubt, consultation with interdisciplinary team members or pain specialists is a critical step in ensuring accurate diagnosis and effective management, aligning with best practices and regulatory requirements for quality patient care. Question 19. Cost-benefit analysis shows that investing in comprehensive pain assessment tools and training for nurses significantly improves patient outcomes and reduces healthcare utilization. A certified pain management nurse is evaluating a patient reporting severe back pain despite normal neurological examination and unremarkable MRI results. Which of the following approaches best reflects current best practices in pain management and regulatory expectations for patient assessment? Option A. Focus solely on pharmacological interventions that target presumed underlying physiological causes, irrespective of the patient's subjective experience. Option B. Prioritize the patient's subjective report of pain, exploring potential psychological and social contributing factors, and collaborating on a multimodal pain management plan. Option C. Assume the patient's pain perception is exaggerated due to psychological factors and recommend a referral for psychiatric evaluation before initiating further pain management. Option D. Rely primarily on objective findings such as vital signs and imaging results to determine the severity of pain and guide treatment decisions. The correct answer is B. Prioritize the patient's subjective report of pain, exploring potential psychological and social contributing factors, and collaborating on a multimodal pain management plan. Explanation. The scenario presents a common challenge in pain management, discerning the subjective experience of pain from objective physiological indicators. Patients' pain perception and interpretation are influenced by a complex interplay of biological, psychological, and social factors, often referred to as the biopsychosocial model of pain. A certified pain management nurse must navigate this complexity, recognizing that pain is a personal experience and not solely a symptom of tissue damage. The challenge lies in validating the patient's reported pain, while also considering other contributing factors and potential influences on their interpretation, all within the ethical and regulatory framework governing patient care. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to the ethical principle of beneficence. By actively listening to the patient, acknowledging their subjective experience, and seeking to understand the context of their pain, the nurse demonstrates respect for the patient's autonomy and their lived experience. This approach aligns with the regulatory expectation to provide comprehensive and individualized pain management, which requires a thorough assessment that goes beyond purely objective measures. It also reflects the ethical imperative to alleviate suffering, which necessitates believing and validating the patient's report of pain. An incorrect approach that focuses solely on objective findings, such as normal vital signs or imaging results, fails to acknowledge the subjective nature of pain and can lead to patient distress, mistrust, and undertreatment. This disregards the regulatory requirement for a holistic pain assessment and violates the ethical principle of non-maleficence by potentially causing harm through neglect or dismissal of the patient's suffering. Another incorrect approach that assumes malingering or psychological overreaction without thorough investigation is unethical and unprofessional. It can lead to misdiagnosis, inappropriate treatment, and damage to the nurse-patient relationship, violating ethical duties of care, and potentially contravening regulations that mandate fair and unbiased patient assessment. Professionals should employ a decision-making process that begins with active, empathetic listening to the patient's narrative. This should be followed by a comprehensive assessment that integrates subjective reports with objective data, considering the biopsychosocial context. When discrepancies arise, further investigation, consultation with colleagues, and open communication with the patient are crucial steps. This iterative process ensures that pain management is tailored to the individual's unique needs and experiences, upholding both ethical standards and regulatory compliance. Question 20. Strategic planning requires a certified pain management nurse to evaluate the integration of complementary and alternative medicine modalities into patient care. When a patient expresses interest in acupuncture for chronic low back pain, what is the most appropriate initial step for the nurse to take to ensure patient safety and adherence to professional standards? Option A. Consult current evidence-based guidelines and professional organization recommendations regarding the use of acupuncture for chronic low back pain, and review the nurse's scope of practice concerning CAM referrals. Option B. Recommend acupressure techniques that the nurse can demonstrate, as this is a less invasive intervention that can be performed without specialized licensing. Option C. Immediately refer the patient to a licensed acupuncturist based on the patient's expressed interest, assuming acupuncture is a generally accepted pain management technique. Option D. Advise the patient that acupuncture is not a recognized pain management modality and discourage its use, focusing solely on conventional pharmacological treatments. The correct answer is A. Consult current evidence-based guidelines and professional organization recommendations regarding the use of acupuncture for chronic low back pain, and review the nurse's scope of practice concerning CAM referrals. Explanation. This scenario presents a professional challenge due to the evolving landscape of complementary and alternative medicine, CAM, within pain management, and the need for nurses to adhere strictly to their scope of practice and evidence-based guidelines. Certified pain management nurses must navigate patient requests for therapies like acupuncture and acupressure, while ensuring these interventions are safe, effective, and align with established professional standards and regulatory frameworks. The core challenge lies in distinguishing between evidence-supported CAM modalities and those lacking robust scientific backing, and in understanding the legal and ethical implications of recommending or facilitating such treatments. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care, which are foundational ethical and regulatory principles for all healthcare professionals. By consulting established guidelines from professional organizations and regulatory bodies, the nurse ensures that any recommendation or integration of acupuncture or acupressure is supported by current research and aligns with the Nurse Practice Act and relevant standards of care. This approach upholds the nurse's responsibility to provide competent and ethical care, avoiding the promotion of unproven or potentially harmful interventions. It also respects the patient's autonomy by offering informed choices based on reliable information. An incorrect approach that involves recommending acupuncture or acupressure solely based on anecdotal patient reports or personal belief, without consulting evidence-based guidelines or understanding the regulatory scope, represents a significant ethical and regulatory failure. This could lead to patient harm if the intervention is ineffective or contraindicated, and it violates the professional obligation to practice within the bounds of evidence and competence. Furthermore, failing to document the rationale for recommending or not recommending such therapies, or failing to assess for contraindications, would be a breach of professional documentation standards and could have legal ramifications. Recommending treatments outside the nurse's scope of practice, or without appropriate collaboration with physicians or licensed acupuncturists, also constitutes a regulatory violation. The professional decision-making process for similar situations should involve a systematic evaluation. First, the nurse must identify the patient's request and the underlying pain management goals. Second, the nurse should consult current, evidence-based literature and guidelines from reputable pain management and nursing organizations regarding the efficacy and safety of the requested therapy, e.g., acupuncture, acupressure, for the specific pain condition. Third, the nurse must review their professional scope of practice and any relevant state or national regulations pertaining to CAM therapies in nursing practice. Fourth, if the therapy appears to have some evidence and falls within or can be safely integrated into the nursing plan of care, e.g., by referring to a licensed practitioner, the nurse should discuss the evidence, potential benefits, risks, and limitations with the patient, ensuring informed consent. If the therapy lacks evidence or falls outside the nurse's scope, the nurse should explain this to the patient and explore alternative, evidence-based pain management strategies. Documentation of this entire process is crucial.